Whenever you make a medication error, it's extremely important that you let the physician know right away. I have one situation where I had a student out on externship who actually gave a Depo testosterone shot in place of a Depo-Provera shot. Now this patient left thinking that she was protected, and she wasn't, and the student was too afraid to tell anyone. About a week later, she was talking to another student and told what had happened. That student encouraged her to tell the supervisor, but she wouldn't. As a result, that other person went to the supervisor and told them. They terminated the girl right on the spot. You always, always have to make sure that if you make a medication error, you do something about it. She might have thought that it was not a big deal, but it really was a big deal. If that person would have gone out and gotten pregnant, not only did she not know she wasn't protected, but she might have set her up for birth defects. You can't wait to tell somebody when you make an error. You need to do something about it right then and there.
In the busy day-to-day life of a medical practice, how can you ensure that patients are receiving the correct medications? It's easier than you think. Just be sure you follow the 6 rights of medication administration. Verifying each aspect to be sure it is right will ensure that no mistakes are made when administering medications.
The 6 rights to be verified are the right drug. To be sure the correct drug has been selected, compare the physician or qualified practitioner's order with the label on the medication container. The right dose. It is essential that the patient receive the right dose. You should verify that the dose on hand and the dose ordered are the same. The right route. You should check the medication order to be sure that the medication you have on hand is in the proper form for the ordered route of administration. The right time. Check the medication order to ensure that you administer the drug at the prescribed intervals. This ensures that the drug is maintained at the proper blood level. The right patient. You must verify the patient's identity every time you administer a medication. Verify by asking the patient their name and date of birth. The right documentation. The most vital link in verifying accuracy is documentation. Clear, concise, and accurate data must be recorded in ink on the patient's chart. It should include the date and time of administration, the name of the medication and dosage administered, the route of medication administration, the name of the practitioner who ordered the medication, any complications during administration, any unusual reactions experienced by the patients, the reason why a medication could not be given, and a record of the medication disposal according to institutional policy if applicable, the patient's vital signs when appropriate, notes on the effectiveness of the drug when appropriate, your name and title.
Verify the 6 rights before and after preparing the medication, and then before administration, to protect the patient's safety. During the following scenarios, note any other error prevention techniques used by the medical assistant.
MA tip. For the safety of the institution, the patients and yourself, only administer those medications that you have actually prepared, and do not allow someone else to administer a medication that you have prepared. Once you have prepared a medication for administration, do not leave it unattended.